Morning, everybody. Welcome back to day 2 of our main conference sessions. So happy to have you back, and we're excited to get started. We have 3 sessions again today, like yesterday, and our first one will be starting in just a few minutes, but I'll just share a little bit of an overview and also just some reminders and a little bit of new information for today as well. So the 3 sessions today will be helping assisters understand some of the unique coverage perspectives and needs and opportunities of working with specific communities in Wisconsin. So helping you to understand what might be, again, opportunities and how to present information in ways that feel most relevant. We'll also continue the conversation we had started yesterday, thinking about the particular coverage landscape that we're experiencing this year, especially with the marketplace, and what options consumers may be considering, both for themselves as they look at affordability, and how we can help them understand some of those options and pros and cons of all of those. I did want to share that I believe we will post in the chat today and yet this morning the evaluation link that we shared towards the end of yesterday. So that'll be the evaluation link for the sessions yesterday. If you wanted to take a quick moment to complete those, we already have been looking at those, which is super helpful. And actually, as a result, we will also be sharing on our website. There was an interest in acronyms, a list of acronyms that are used. And there's the link as well, which is great. And it's in the chat. And also both of these things will be posted on our website for the conference. And also, we will be doing yet another gift card drawing today for those in attendance today. So that'll be at the end of all of our sessions this afternoon. And so please do stick around for that. And overall, welcome again for being here and for being a part of this conference. I'm excited this morning to get us started. And again, focusing on a specific community in Wisconsin of the farm and farm worker community, and just what are those unique needs and perspectives that we can better understand to serve with coverage options. So first, I'll introduce Tina Marshallek, who will be facilitating this session. So Tina is the Community Relations Coordinator for Covering Wisconsin. She is also a navigator. She chairs the Central Regional Enrollment Network, as well as the Dane County Health Watch Coalition. And she presents a lot of trainings and presentations, both for professional and consumer audiences around the state for Covering Wisconsin. She also does quite a bit of outreach throughout the state and looking at both health insurance literacy programming as well as content related to our navigator work. So in previous years, some of her contributions for this conference addressed lived experience, trauma-informed care, Medicaid special topics, and coverage considerations for young adults. And today, she is here to introduce and moderate our first session, the health coverage considerations for farming and rural communities. All right. Thank you so much, Tina, and I'll hand it over to you.
Thank you. Good morning. Welcome to Health Coverage Considerations for Rural and Farming Communities. My name is Tina Marshallek. I am the Community Relations Coordinator for Covering Wisconsin, and I will be your session facilitator for today. We are also joined by some wonderful session speakers, Gabriela Martinez Motta, who is a bilingual navigator with Covering Wisconsin, Michael FitzPatrick, who is the Mobile Clinic Coordinator and Lead Community Health Worker with St. Clare Health Mission, Yu Lee, who is a project specialist and the Hmong Enrollment Network lead with N.E.W, and Francisco Guerrero, who is a bilingual navigator with the Wisconsin Institute for Public Policy and Service. Our plan for today is for me to give a brief introduction, and then you won't hear that much of me for the rest of the session. I'll give some context setting and some quick tips and tricks, and then I will pass things off to Gabriela, who will present her Nelson Institute research about farmers and health insurance. And then Michael FitzPatrick with St. Clare Health Mission will present about their mobile clinic initiative, which is a great example of a community project that helps meet people where they are for rural communities. Then Yu Lee will present about an outreach project to Hmong farmers in Northeast Wisconsin. And Francisco will present a navigator's outreach project to dairy farmers in Central Wisconsin. When considering assisting farmers with health insurance, I want us to take a second to look at what uninsured data we do have. This is data from the USDA from 2015. So it has not been replicated in a more modern way, and the 2015 data is what we have to go off of. According to the 2015 USDA data, you can see how dairy farmers are uninsured. Were uninsured at 41.4%, which was staggeringly high compared to the other farmer categories. And all farm households were uninsured at an average of 10.7%. Of course, we know many of the farmers in Wisconsin are dairy farmers, or we have a large dairy farming population in Wisconsin. In 2015, by comparison, Wisconsin's uninsured rate was 5.7%. And in 2025, today, Wisconsin's uninsured rate is 4.9%. And when supporting farmers with health insurance, consider some of the principles that you already know for enrolling self-employed consumers. Since farmers are typically self-employed, you would follow the same enrollment guidelines as you would for any self-employed person. There are a few things to know or remember. One is the consumer may have a Schedule F instead of a Schedule C. Think F for farm. Medicaid applications may count the prior year's income unless monthly income can be itemized on and approved from the self-employment income report. On healthcare.gov, you report the net income, that is the profit, or what you report on your Schedule C. And to verify income on healthcare.gov, you may be asked to upload a self-employment ledger, which healthcare.gov describes as an accurate, detailed record of your self-employment income and expenses. Also, when supporting farm workers with health insurance eligibility, it's good to be aware that many farm workers may not qualify for health insurance programs based on immigration status. According to a 2023 study at UW-Madison, an estimated 70% of the labor on Wisconsin dairy farms is performed by undocumented immigrant workers. So for these consumers, mobile or free clinics can be especially important. And then we'll move on to our first poll question. Mike, if you're able to post that for me. When applying for Medicaid or the marketplace, enter a farmer's income the same way you would for any self-employed consumer. True or false? And we'll leave that up for a little bit. Okay, maybe we can close it now. And great, most of you got it right. The answer is true. Thank you. And now we can move on to our first speaker, Gabriela Martinez Motta. She is a bilingual health insurance navigator and a PhD student at the UW-Madison Nelson Institute. Her research focuses on how to transition to sustainable agriculture work in Wisconsin. Through her agricultural research, she learned the significant need for health insurance access for farming communities. She is here to share her expertise as both an agriculture researcher and a navigator. And I will let Gabby take it away.
Hi, good morning. Thank you, Tina. As Tina mentioned, I'm a health insurance navigator and also PhD student. I'm writing the dissertation, and I'm going to be showing part of my work and what I hear from the PhD research. But before we start, I would like to provide some background of how Wisconsin farming works. In Wisconsin, we have 58,521 farm operations in almost 14 million acres. And the average farm size is 235 acres. size. Of course, we have large farms, medium farm size, and small farms. Usually small farms are family farms and large farms are from big operations and companies that manage those. In Wisconsin, we have 5,300 dairy farms with 1.28 million cows. That's a lot of milk and beef. And annually, 9.5% of the state employment belongs to farming. So it's almost 10% of our state of Wisconsin employment that the farming community provide. We can move to the next one. Wisconsin, as many parts of the United States and the world, it's struggling with the number of farms declining every year. We need to do more research on the impact that this decrease in farming implies for rural communities. We know that some rural communities become to be a ghost community. So we need to do more research on that. The profitability, the quality of life, and access to healthcare are all priorities for farmers. Many times people think that it's only the profitability, but farmers want good quality of life. They care about the land, the water quality, and access to health for their families and their cattle. Many farmers struggle to keep both the farm profitable and the families healthy. As Tina mentioned, we have not all the farmers struggle with the same, especially with health insurance. Dairy farmers are the most uninsured population on the farming community, with a 41.4% of dairy farmers uninsured. We need farmers for affordable healthcare. There are significant impacts if a farmer is sick. In some cases, when this is extreme, this will lead to shutting down all the farming activities, because if the farmer can't work, and especially if it's a small farm, if the farmer can work, probably the spouse that usually has an off-farm job will need to be in charge of the farm and miss her job. So that will imply and also take care of the farmer in the hospital or at home, or will need to hire someone that we know labor. It's a problem in the farming community also. Healthcare costs affect commercial farming also. And this is important because we want also considering small farms or medium farms. This has a big impact on the large farms. Some researchers in Wood in 2005 reported that the cost of health insurance is the most serious threat to farm, more impactful than land cost or market conditions. We know that the land costs in Wisconsin have been increasing over the years, but the health insurance is one of the biggest costs that farmers have. I have been working in Grassland 2.0 as part of my PhD. This is a USDA-funded project that started in 2019, and we developed a process that is called collaborative landscape design. This is a place-based learning process, and the output of Grassland 2.0 is to create an agroecological transformation plan. This means help farmers and the farming community to develop this plan to move to a sustainable agriculture, from crops to grasslands, and all the economic, with health, with supporting to farmers on how to transition to this, as well as to create new markets. As part of this process, the collaborative landscape design, between 2021 and 2023, we conducted more than 75 interviews. I conducted in the 3 learning hubs in Wisconsin, and we partner with different local organizations. These interviews involve all the actors within the farming system, not only farmers, also bankers, county specialists, farm credit, meat processor, restaurant owner, tourism, and farmers. We wanted to hear from everybody. So we interviewed crop farmers, grazers, beef and dairy farmers, as well as in some areas of Wisconsin, we interviewed ginseng growers to understand the whole system. And we learned one of the greatest challenge for the farming community is access to health insurance, even if that wasn't an initial worry from our team. So at the beginning, we had 3 learning hubs that were Clover Belt in the north of Wisconsin, and then Region Valley and Driftless on the southwest. In these 3 learning hubs, it was where I did my PhD work, and we with local organization and stakeholder community, we developed a questionnaire of 15 questions in each learning hub. And it has, in each learning hub, we have similar questions, but also 4 specific questions for each learning hub. Once we gather all the information, we work with a graphic illustrator to grab 3 themes from the interviews and to show the themes in panels. So then we went back to the community and show them what we hear. Part of the questions were, how do you see the agricultural system now? How do you think the agricultural system will be in 20 years? So we developed the panel that we call Story of Now, and another panel that we call How the Future Could Be, and the pathways. So how we're gonna move from the now to the future. And I'm gonna show you some of the results focused on what we hear from health. Next slide, please. So in the Story of Now, regarding health, we hear I'm showing here the Region Valley, that was one of the learning hub, that off-farm employment is needed to access health insurance. So one of the spouses of the farm, especially in small farms, need to have an off-farm job in order to have health insurance. The variety of accessible healthcare options exists. They want more options. Nowadays, there are more isolation, are less opportunities to interact because of fewer schools, churches, and community gathering. They all mentioned that COVID had a great impact on the connection between the farming community. And they also mentioned that there is a need to consider public health. Also, farmers mentioned the problem to access to health because they never know when they will be able to go to see a doctor, and that is a big problem in the farming community. With the pathways, they suggest use a regional approach to pool resources, knowledge, and work collectively, and more walking and mobile clinics. This was something that most farmers request, like a clinic moving between farms in specific days, so the farmer doesn't need to go to the clinic. That take a long time in the farming community. For the Story of Future, what they say as they see in the future regarding health, it's a robust and accessible healthcare designed for an agricultural community. Many farmers mentioned that the system brings the same system to the farming community without taking in consideration how the farming community works. Also, they mentioned that they want affordable health insurance. And here are some quotes of the interviews. Robust and accessible healthcare designed for the agricultural community, access to health insurance for farmers and affordable healthcare, more walking and mobile clinic, increase on timely access to healthcare, access to healthcare for farmers, including mental health and reduced cost. We interview one nonprofit that works specifically with family of farmers that commit suicide, and that was something really important to learn from them. Also, other farmers and the farming community mentioned everything together, community, farming, and clean water. So if you have health people, you have a healthy community. Closer clinics to the rural Wisconsin, easier access to medical appointments. We know that if a farmer wants to schedule an appointment, probably will need to drive between 1 hour and an hour and a half to go to the clinic. And that when you're a farmer, it's a long time. You woke up at 4 a.m., especially in the dairy farm, to milk your cows, and sometimes you milk your cows between 2 and 3 times per day. So if you need to destinate 3 hours to go to the doctor, probably you won't do it. More health education for farmers and prevent illnesses. They mentioned this, saying that it is important for them to know the consequences of not having access to health. Off-farm job is needed to access health insurance and financial support for farm operations. Sometimes, as I mentioned, the spouse need to go and work or farm, or even the farmer. Many farmers are school bus drivers because they can do that while they are farming. Next slide, please. Well, but what we learn from this process? Well, the first thing that we learn is time and resources are needed for project preparation and hub formation. Another researchers at Red et al. And Rosing et al., they agree with the same, they mentioned the same in their research. To create each learning hub took us between a year and a half because you need to build trust. Trust building, it's a key aspect on this process. So, and that implies time and money because you need to organize gatherings, you need to go to the place. Most of the interviews, we did it in person, and that's make a huge change. That's building trust. It's way important for the success of the project. Effective transitions depend, as I mentioned, on trust between stakeholders, expertise, and community, as well as the commitment. Rosing et al., they developed a project in Europe and Latin America, and they found the same as us. The importance of building bridges between participants and organization is a key aspect in order to have joint decision-making, because we can expect that the university arrives to a farming community and tell farmers or the farming community, you need to do this, this, and that. This needs to be a collaborative decision-making because the researchers can bring some expertise, but the farmers also have an expertise. And they have the tacit knowledge, and we need to work with that, but we need to trust each other to do this. So we can move to the next one. Health insurance trends for farmers. So what we hear and other researchers mention, farmers are less likely to use federal and state programs and are more likely to pay for private insurance. Paying for expensive private health insurance has an economic impact on the farm economy, and the access to quality and affordable health insurance support farm profitability and prevent economic hardship. We all know that if you get ill, could be really expensive, and farmers will use the money that destinate for farming to pay for the health insurance and all the health costs. Beckott and N.E.W reported in 2022 that half of farm households reported that health expenses limit farm investment. So 60% of interviewees reported that if health expenses were lower, they will be able to invest and make improvement on the farm. 56% would save for retirement, 20% will save the money, 17% will invest in the household, and 8% will use the money for college. And what challenges to accessing health insurance? Well, farmers, as I mentioned many times, need to get enough farm jobs to have employers sponsor health insurance. Being self-employed means more complex tax situation, as Tina explained earlier, which can impact eligibility for income-based health programs. Many farmers' income are too high to qualify for Medicaid, and many farmers are too young to qualify for Medicare. And this is a problem to encourage young farmers to encourage young people to become farmers. Assistance with healthcare.gov is extremely important for this population. If we can go to this community and help them apply to healthcare.gov, will be a huge resource for them. And we have the poll question that it's according to the 2015 USDA data, what percentage of dairy farmers are uninsured? A, 10%, B, 20%, C, 30%, and D, 40%.
Thank you, Gabby. So we can leave up the poll question for a minute here so that people have the time to answer. And while we're doing that, I'm going to transition to pulling up our next presenter's slides. Okay, I think we can make the poll question public now. Great job, everyone. That's great to see. The correct answer is 40. It's 41.4% to be precise, as both Gabby and I addressed in our presentations. And now we'll move on to our next presenter. Thank you very much, Gabby. You have such a unique perspective on this topic, and I really appreciate you taking the time to present your research. Our next presenter is Michael FitzPatrick. He is the Mobile Clinic Coordinator and Lead Community Health Worker at St. Clare Health Mission. He has a background in street outreach with unhoused populations in La Crosse, Wisconsin, and holds a Bachelor of Arts in Educational Studies from Western Governors University. Michael believes strongly in meeting people where they are, breaking down barriers to care, and building trust through genuine relationships. His goal is to help create a healthier, more inclusive community where everyone has access to the support and resources that they need. So feel free to take it away, Michael.
Thank you so much. Yeah, my name is Michael. I'm with St. Clare Health Mission in La Crosse. I've been with St. Clare for just over a year, almost a year and a half now. We can move to the next slide, please. Thank you. So what is St. Clare Health Mission? We are a free clinic located in La Crosse, Wisconsin for individuals without health insurance. We opened in 1993, but before that, it was a clinic for refugees from Laos. A group of people, including the Franciscan Sisters of Perpetual Adoration, got together and said, you know, this clinic, there's still a need for a free clinic in our community, and that's when St. Clare Health Mission was born. We offer a full-scale pharmacy as well as a full-time therapist who can provide free counseling to those in need. Our pharmacy medications through our main clinic are all free to the patient. Our mobile medicine unit was donated to St. Clare Health Mission about 3-ish years ago in partnership with Rotary. And we partner with both Amplify Health, formerly Gunderson, and Mayo Health System to provide care for things that we cannot address at our main clinic, such as radiology or OB, GYN. And any referrals that we do from our main clinic, our patients are not charged for those. We're entirely volunteer run aside from the team of folks here who are either part-time or full-time. There's not very many of us. And both our main clinic and our mobile clinic are used as teaching programs for local institutions to help up-and-coming resident physicians practice medicine outside of a traditional hospital or clinic setting. They rotate through both the mobile medicine program and our main clinic, which is open Tuesday and Thursday nights. Next. So street medicine is the program, or mobile medicine is the program I oversee, and I'll kind of talk about the two different areas that we do on street medicine here. So street medicine is on Wednesday mornings. We really focus on our unhoused populations in the area, regardless of insurance status. So most of our folks do have Badger Care or Medicaid. Some have Medicare. The goal of this, though, is to help bridge that gap between health and unhoused living situations. Common needs, we treat wound care, substance use disorder. This is staffed with Amplify's Family Medicine Residency Program. The La Crosse County Health Department also joins us, which has been integral into growing our programming. They are providing nursing, vaccines, and other things as needed, and they also have a social worker who comes and helps individuals access Medicaid and other public benefits as well during mobile medicine times in La Crosse. Next. And then for rural medicine, that is on Friday mornings. We're providing medical care in more rural communities and on farms to individuals without health insurance. One of the larger communities that we serve is about an hour outside of La Crosse. It has a higher population of uninsured workers who work on farms, factories, or food processing plants. And on Fridays, we are staffed by either Amplify's Family Medicine Residency Program or the Mayo Family Residency Program from La Crosse. We also have a tremendous volunteer nurse practitioner that joins us as well to help out with an extra set of hands because we do see so many patients on these days that any extra support we can have is very much welcomed. Next. We also have started doing an STI clinic to meet the needs of populations in La Crosse. So we partnered with La Crosse County and Vivint Health. We're doing those monthly. And then also Vivint Health also does come out with us on Wednesdays and hopefully soon Fridays to provide testing for individuals as well. And then we also do sports physicals over the summer. So we're just wrapping up sports physical season. And that's just for underserved communities and students that may not have access to care. Or for the students whose parents are unable to take off of work. It's really anybody who needs a physical for sports can come see us. We can go to the next one. So this is our actual mobile clinic itself. We have 2 exam rooms, a bathroom, lots of storage, an awning, the ability to do exams, like an exam table, procedure, supplies. We also have a wheelchair lift, so it's accessible for folks, and much more. Really, I always tell folks, whatever you can accomplish on a primary care visit, we can accomplish here. We have an EKG machine on board. We also have a lab machine on board. However, we tend to send people into the Mayo labs to do labs. Next. So some barriers to care. So for our unhoused populations, not having a residence or place to stay, lack of access to basic human needs, transportation, fear and stigma. For our rural populations and our farm communities, that fear and stigma is very much, it's substantial. A lot of the folks we serve are Spanish speaking and may not have legal status. They may not have health insurance. They may not be eligible for health insurance. So those are some of the barriers that we see in our patients, which is why we meet them where they're at. It's safer for folks, for us to come to them sometimes. Another interesting component of this is the holistic medicine versus Western medicine views. Our teams are tremendous in allowing patients to have the autonomy over their own health care. A lot of our more rural farm workers that are Spanish speaking prefer a lot of more holistic medicine alternatives, and our team is very encouraging of that. One other barrier that we've really experienced over the past few years is a fear of engagement from employers. So getting farms on board for us to come to them can be tricky, especially given some of the stigma and fear surrounding undocumented workers. Can make it a little bit more uncomfortable to open up and say, yes, let's have this free clinic come to our farm and provide care to our people. Next. So these are some mobile medicine numbers. These were as of the end of July. I just finished totaling up August, so they're a little bit higher now. We had 462 individual visits on our street medicine program, 82 visits on our rural medicine program. That really encompasses farms and those smaller communities. It's important to note too that in summer when we do sports physicals, that sometimes takes us out of the more rural communities. So we will get back to that work in the rural communities. We've been already back again, which has been great. And then about 69 sports physicals this summer. All of these things were provided free of charge to our patients. No, that was super quick. But if you have other questions, feel free to email me or reach out. I'm super grateful to have this opportunity. Thank you.
Thank you so much, Michael. It's really exciting to see a community initiative with a mobile clinic because we heard from Gabby about the feedback from farmers saying that more mobile clinics were really important to reducing the drive times in rural areas to access healthcare, and even just meeting people where they are when they are too busy to get to the doctor. So thank you very, very much. And it's something that other health systems can potentially replicate, right?
Absolutely. Absolutely. It's all in the power of just having a really great team who's willing to break down those brick walls and meet people where they're at.
Amazing. Thank you so much.
Yeah.
I'll present our next speaker, Yu Lee. Yu Lee is the project specialist at N.E.W, located in Appleton, Wisconsin. She manages the Farmers Initiative Department. Through a partnership with Covering Wisconsin, she led the statewide Hmong enrollment network, where members were kept informed about the Badger Care and Medicaid unwinding process and other health equity topics. She strives for a holistic and thriving well-being for all community members through culturally relevant access to resources, strengthening and bridging system gaps, and collaborating with partners. And I will let you take it away with your presentation if you want to share your slides.
Thank you, Tina, for the introduction, and thank you for inviting me here today to share a little bit more about our work. So I work with Northeast Wisconsin Hmong, or New Hmong for short. So before I begin speaking about some of our programs that we have here, a little background. So our program started after the pandemic. Many Hmong elders expressed loneliness, isolation, and fear of going out due to COVID-19 and the Asian hate that was going around at the time. So our program started as a way to be a safe space for our elders to connect, and then also to address mental health, food insecurity, and then cultural desert. So it first started with the local food purchasing assistant program through Marble Seed in Madison. We provided language support and technical assistance, and then it eventually evolved into some of the programs we have now. So I'm going to provide some of the outreach insight, and then through my dual role as the Hmong Enrollment Network lead, share some of the perspective for healthcare challenges that our farmers faced. So one of our program was through a partnership with St. Joseph Food Program. We worked with 7 farmers who worked on a 1.5 acre plot. And this was given through a partnership with St. Joseph. So we gave this plot for them to farm on for free. And our only requirement for them was that they donate produce to the St. Joseph organization. So they have donated over 900 pounds so far. So this was a way for farmers to access land who didn't have resources to purchase or find farmable land. And then another program that we had is our wholesale pilot program. We worked with 17 farmers since the inception to support economic development. So we purchased directly from our local farmers, and then we worked with 11 end users. So most of them being food pantries, and then also organizations, for example, Multicultural Coalition, Inc., where they served refugees and immigrants. And so the end users picked up produce from the farmers directly. And that, as you can see on the map to the right, this is where all of our end users are located, from Brown County down to Fond du Lac County. So overall, over 43,000 pounds of produce have been picked up and counting, since I haven't added the numbers from the season yet. And then another one of our program is called Luca Project. So Luca, it's the basket that you see in the second photo here. It's a basket that Hmong people used to use back in Thailand, Laos, to put their produce in there when they go to their garden. This program overlaps with another one of our program. My colleague there in the last photo, she does the Hmong Elders Activities programs. And so we buy from our other program, so the 17 farmers, we buy from the farmers, and then we bring it to our New Hmong location, then we package them, and then we deliver them to our Hmong elders. So these produce are procured, are culturally relevant produce that our Hmong elders would like to eat and prefer. And so this was to address cultural deserts because our Hmong elders, they may not have access to land to garden, or they may be having other issues or like issues to getting to cultural produce, such as either old age or illnesses or being non-mobile. So overall, 3,000 pounds to our Hmong elders and counting, since I haven't added the numbers from this season as well. And then on the off season, we provide educational workshops. So some of the topics you see are soil health, value-added products, and wholesale. And we partner with different local organizations and also across the state to provide these presentations. They either present or they also provide support through funding. So through these different programs, I reiterate what Michael and Gabriela said about meeting farmers where they're at, not just in location, but also in capacity and language. So we provide logistical help, technical assistance, and the support throughout the season, such as the educational workshops to expand their markets and then to support them their capacity. So we try to bridge their gaps in learning, and then also what we can't do, we connect them to resources. So we're happy to have earned their trust, and then we also look onto them as experts to support them where they want to go. Because one of our goals through these programs was to get our farmers wholesale ready so that they can access more markets. But through these experiences, we learned that some farmers are still very small scale. They are not ready to get to that step yet. And so our wholesale pilot program, we are a bit more flexible with the wholesale readiness, and through the local pantries, we're able to do partway wholesale so that they don't have to they are able to access the funds because they aren't wholesale ready. And then one of our biggest challenge, so I'm not going through the whole slides, but one of our biggest challenge was the system and language gaps. The hugest barrier for our Hmong farmers was the language barrier. They were not able to access programs before because they didn't understand the English language, or there was not materials to promote it in their language so that they would understand it. And so it was very pertinent that there was like a Hmong staff or someone speaking Hmong to help bridge like them to these resources. And then besides that, when our Hmong farmers were able to enter into these resources and programs, for example, the local food purchasing assistance program, there was still a learning curve for them because they did not understand wholesale regulations and wholesale methods. So these challenges play into the healthcare access as well. Many Hmong farmers express like that farming is a way for them to promote their mental health, because when they go farm, they're in an environment that feels free and refreshing. So they use this word that they say "gashia" or "lashia." They feel like freeing when they are farming, and then they get to see the fruits of their labor. So this is a way to address their mental health. But besides gardening, there are still lack of cultural relevant resources for them to address mental health. And then some of our farmers who live in the rural areas, they say that there's a lack of affordable insurance. And then there's also a lack of system support from funding for small scale farmer overhead, because local organizations that do support farmers, there's restrictions in funding that our farmers can't access to support their overhead in general. And then besides healthcare access, there are other social economic factors as well. For example, language interpretation, difficulty or misunderstanding the navigating the healthcare system. And then there's also stigma and judgment from non-Hmong doctors who treat our Hmong clients and on their beliefs. So in the future, currently we are working to establish a food hub that's a central location for our farmers to collaborate, share stories, share selling opportunities, and then also provide training that is language and culturally relevant. For example, in the future, would like to provide a training or a workshop on health access using Covering Wisconsin health literacy how-to sheets, hosting listening and educational sessions to promote safe farming, mental health, and then discuss barriers specific to farmers. And yeah, thank you. And if you would like to reach out, my information is there. Thank you, Tina.
Thank you so much for sharing about all the outreach that your organization does with Hmong farmers. It's really helpful to see what methods are effective and what your takeaways were from your unique vantage point being the Hmong Enrollment Network lead. So thank you very much for all your work. And before I introduce our next presenter, I'll mention that we do have the Q&A feature available. I'm sorry, I neglected to mention this at the start of our presentation, our session here. If you have any questions for our speakers, we're hoping to have some time for Q&A at the end, and we would love to give them the opportunity to answer your question. So our next presenter is Francisco Guerrero. He was born and raised in Chile, South America, where he earned a degree in agricultural engineering. He moved to the United States in 2009 and currently serves as a health coverage navigator and Hispanic community health coordinator with the Wisconsin Institute for Public Policy and Service, or WIPS for short. In his role at WIPS, Francisco collaborates with county health departments to develop language accessible, literacy level appropriate, and culturally tailored materials promoting adult vaccinations, civil dialogue, and connecting community members to resources. He coordinates the Hispanic community health worker outreach efforts, oversees the translation of materials, and provides Spanish interpretation at community health events. He also offers health navigation services, connecting community members with health insurance options, improving access to healthcare. And I will share his slides now so that he can share about some of his outreach efforts in rural communities and farming communities in central Wisconsin. So thank you, Francisco.
For the opportunity to come and present today, and thank you for letting us tell our story. So, as I mentioned, my name is Francisco Guerrero. I work for the Wisconsin Institute for Public Policy and Service, and we have a couple projects. One is the Hmong and Hispanic Communication Network. Another organization that we create is HOLA, Healthy Opportunities for Latin American, that focus on the Hispanic population here in central Wisconsin. And also we are partnered with Covering Wisconsin. Next slide, please. So in central Wisconsin, has become like the second largest county when it comes to Hispanic population. One of the main reasons for this is the dairy industry. In Marion County alone, we have 347 dairy farms, just second to Dane County. In today's landscape, when it comes to farming, if you go to any dairy farm in Wisconsin, you will see Hispanic workers working at the farm at different capacities, milking cows, taking care of the calf, cleaning, feeding. It's pretty much like our culture is part of the industry in Wisconsin. Next slide. But also, when we think about Hispanic families, we have to also understand the Hispanic mix situation for health insurance. And if, for example, we think on a family of 4, that has a work permit, mom is undocumented, a son or daughter born in the U.S., a daughter or son with a DACA recipient. Everyone fits in some sort of primary care provider or health insurance. The question is like, what are those options that are available for them as navigators? Our work is to really be creative, understand the landscape in our region, and really trying to connect those families to the services they need. And when we think about like what are those opportunities, it's like really understand what the FQACs are in your area, what are the free clinics available in your area, what can be a point of service clinic also available in your area, how to navigate the financial assistance program for every clinic and hospital that you have. And if, for example, I talk about central Wisconsin, central Wisconsin have become very centralized when it comes to healthcare. We have 2 major systems, Marshfield Clinic and Aspires. And both, in order for you to go, need to understand how they work. Marshall Clinic, for example, everything is centralized. One application fits all the services, but in the case of Aspirus, it's more of an associate clinic with contractors. So sometimes you go because you need GI services, but those are not covered by Aspirus, so you need multiple applications, and we need to understand how those health care system work in order for us to provide the best service and the best answers to these families. Next slide. So I'm gonna talk in particular about a collaboration that we have with multiple health departments and community-based organizations. Espeseth is a small town located here in central Wisconsin with a large population of Hispanic. The reason behind that is because we have a meat packing company in Espeseth. We also have a large number of farms also located in Espeseth, and is a town that is divided into different counties. Clark counties, actually 3 counties: Clark County, Marathon County, and Taylor. So every health department can need. Actually, we all came together to offer multiple services at a location that. We do food pantry. It's run by our organization. Ruben Silva is the director of the pantry. He's a colleague of mine, a community health worker also, and a health navigator. And he's able to provide services at that location, and not only making sure that food insecurity is something that we take care of, but he's also able to, for example, provide services for health navigation and connect people to resources. So this network of collaboration between multiple organizations has been key in order for us to provide services to this community. Next slide. So when we think about doing outreach in the Hispanic community, and as what was mentioned before by Michael also, we have language, cultural differences, housing insecurity, racism, immigration issues, lack of workplace protection, poverty, evolving, changing information, and health insurance literacy. Also, when we think about us going as navigator to go and talk at the dairy farm about health insurance, it's going to be very, very difficult to get into that farm. So we have been very fortunate to be able to offer more than just health navigation, but at the same time, everything connect with the services that we provide. So when we think about offering services at the dairy farm, we need to connect to what are the needs in those industries. We understand that, for example, diabetes is a chronic condition in the Hispanic community. We want to also make sure that people is connecting to a primary care provider, and sometimes just to give the recommendation of, hey, you need to go to or establish yourself with a primary care provider because this can save you a lot of money. It can save you time just to have that. It's something that a lot of time is going to be ignored by the worker. But then if you show a number like, okay, hey, by the way, you have your A1C is high, your blood pressure is high, maybe it's time for you to connect with a primary care provider and we can help you with that. That is something that the workers feel a little more interested on learning and doing. So when we go and visit the dairy farms, we come and do health screening, like diabetes screening, blood pressure check, that give us the opportunity to talk about the health with numbers. We also provide other trainings and programs that we have implemented in the farms, like Stop the Bleed or healthy living with diabetes. Lately, we've been doing CPR classes at the farm. So now we have a program that we can go and teach. It's a good education, good knowledge for the farm, but at the same time, it opened the opportunity for us to talk about other options for healthcare and also to really connect people to health insurance or a primary care provider. Next slide. So in Espeseth, well, every Thursday we run a food pantry. As I mentioned before, my coworker Ruben Silva is the director of the food pantry. It serves over 200 families every Thursday, and when we do the fairs, we have also the health departments coming and providing all the services that they have to offer. And this is like really important to mention because the health department for Clark County is an hour away from Abbotsford, and the health department in Marathon County, the distance from Abbotsford is also about 40 minutes. So if people need to go to see the health department, they're not going to drive an hour because in today's landscape, people is afraid of driving, and also lack of driving license plays also a role before you decide. And transportation is a big issue for people to connect to services. But when we are able to bring services to a community where people live, then we have a great collaboration. And those services that we provide at Abbotsford is we are able to connect with a rural community by providing access to vaccination, doing health navigation. We are able to connect family to a reproductive clinic because health fairs also come to the clinic. Clark County also offers a free dental clinic, so that is kind of a good starting point for people to start taking care of their teeth. We're able to provide car seat safety, also with our community health workers. We're able to connect kids to other organizations that are kind of relevant to the needs that they have. For example, housing security. So we are able to help them navigate that at the fair and actually connect. So creating this trust that then is going to allow us to understand what is the farm that they're working on, how we can connect to the farm, and how can we bring other services to the dairy farm. Next slide. So when we go and visit a farm, as I mentioned before, we cannot go and just talk about health insurance because nobody will open the door for us. But when we go to a farm and we start offering like services like health navigation, free A1C testing, blood pressure check, a program like Healthy Living with Diabetes, Stop the Bleed, CPR training, we're able to start a conversation. And the way it look when it comes to implementation, number one, we connect with the farm owner. Then we start calling all the partners. We work with most of the health departments that are in our area because they're able to provide access to vaccination, which are very important to keep the workers healthy. If we have another partner that is interested in coming to the farm, we also bring them so we can provide more services at that visit. We try to bring a relevant service to the worker. I was mentioned like A1C is a chronic condition that is kind of relevant in the Hispanic community. So we offer free A1C testing. So if we identify anybody with a high blood pressure or high A1C, the number one question is like, do you have health insurance? If they don't, then we start navigating what are the options. If they qualify for Medicaid or the ACA, we start the enrollment process. If they don't qualify for health insurance due to immigration status, then we start looking at what are the FQAC that is close to their area. Or we try to connect them also with the WhatsApp Free Clinic, which has been a great partner in central Wisconsin. Also, the part of the communication that we use to encourage different programs is WhatsApp. It's a chat application that we use a lot to provide messages to our communities. Then when it comes to part of the collaboration is also with MCW, the Medical College of Wisconsin. They have a campus here in Wausau. We have a great relationship with them, so we're able to bring the students, future doctors, to the farm, to the events that we do, so they have a feeling of what is rural medicine look like and how we better serve this changing population that is always evolving, always changing, and also adapting. But we are part of the adaptation because we want to make sure that the services are available to all communities, and for that we need health navigation and we need to be able to provide the services to these communities. Next slide. Also, when we, after we visit a farm, we also identify, for example, a local grocery store in which we know workers are doing their groceries. This was an event that it was called Healthy Summer Tour, in which we have community health worker going to different restaurants or different grocery store in offering the same services, free A1C, free blood pressure check, and navigation. So that way we're able to communicate with them in their own language. So we break a lot of barriers at that moment of time. But the most important thing is that we make sure that we connect them to a primary care provider, or we are enrolling them in a health insurance. When it comes to outreach by the number, from January of 2025, our organization was able to connect with 219 clients. 97 of them did not report the county in which they live. From the one that they reported, the county was Motta County with the most, with the highest count. And most of the clients that we serve describe themselves as having an Hispanic or Latino ethnicity. Next slide. Some of the services that are utilized by our community members, the majority of the clients utilize family support services. So it's not just about health insurance, but it's also about transportation, employment, food assistance, income support, family support, helping kids enroll in school, helping understand how public transportation works. So there is a lot of communication and talking about what those needs are, and where you are able to satisfy those needs, then the trust is start to build, and then you become a trusted source for these communities. Next slide.
I think we want to make sure that we have a second for Q&A, if that's okay. And I think the
Okay.
only slide left is spreading the word, how people heard about you, and your
Yep.
ending slide. Yeah, so I think we'll leave it there, and the slides will be posted at the end of the conference. Thank you very, very much. Amazing work that you have all done. We have a quick question that I think is a clarifying question for you, Francisco. It says, what is Stop the Bleed? Is it a first aid course?
Stop the Bleed is because we know that hospitals are being centralized, and working on a farm is a very dangerous workplace. If they cut themselves and they're not able to stop the bleeding, then it's going to take them half an hour to an hour to get to the services. So Stop the Bleed focus on really giving the tools and the knowledge to the dairy workers on how to stop an episode that involve those kind of injuries.
Awesome. Thank you. And we only have 2 minutes left, but if our other presenters wanted to come off camera for a couple quick questions, there's a question that may apply to all of you. How do you build trust when people don't want to receive any type of public assistance? If anybody wants to respond to that.
I always just go to kindness, and listening to stories and not pushing services right off the bat, and allowing people to have space to talk about their situation, to be open at their own pace, things like that.
Great point. That it is always their decision. There's another question. How do you help educate farmers about the importance of preventive care? You know, we don't only want people going to the doctor when it's an emergency, right? And it sounds like a lot of you are doing that work. Free blood pressure checks. You're in a van with preventive care available. How do you help educate farmers? Yeah.
Sometimes they have to see the number themselves. So, for example, a couple of weeks ago, we were at a dairy farm. We were doing blood pressure check. We identified a few workers with high blood pressure, and then it was the turn of the farm owner to come and do it. He also did it. He ended up having high blood pressure, and that's when the conversation started. Like, when was your last checkup? I think it's important for you to go and visit your primary care provider, because right now the numbers are not looking good, and he's also seeing that. So he realizes also at that time that he needs to take a break, and he also needs to take care of himself, because otherwise he will not be able to run the farm effectively. So sometimes if you're able to show the reality of their health on the spot, then they can also consider themselves that, okay, I think I need to slow down. I need to take care of myself too.
Excellent point. Thank you. And there's another question. I think this is mostly for Michael. Are farmers enthusiastic about mobile clinics, or has outreach to farms been challenging?
I would say it ebbs and flows. I think with whatever the climate is surrounding undocumented individuals in our country, that definitely has an impact. Right now, we have two bigger farms that we do provide services at, but a lot of them have kind of fallen off over time. For a few different reasons, but we're always looking to expand that. The nice thing is that we've been around for so long, so most folks have heard of us, which can be a really a good thing in our corner to help us connect with more people.
Sure. Great to know. There's another question for your service area, I suppose. How long is wait for typically for establishing care with a primary care provider? What kinds of issues do you encounter, if any? If anybody wants to share.
Right now, for example, we understand that in order for you to apply for a sliding fee with an FQAC, you also need to bring documentation. So that kind of slow the process sometimes by a lot, because not all Latino workers will be able to get all the documents. WhatsApp Free Clinic, for example, they recognize that they don't request any documentation in order for them to see, in which speed the process. But right now, also, it has become a very popular clinic for the Latino communities. So right now, it takes about 2 weeks to get a primary care appointment with them.
Okay.
And sometimes that can be a reason why a lot of Latino workers end up being to the emergency room to establish themselves with a primary care provider.
Okay. If anyone else wanted to comment on this question, it'll be our last question. If not, I'll just give a very warm thank you to our speakers who all did an excellent job. And thank you to Claudia Mejia, who works with Covering Wisconsin and was my lovely Q&A support throughout the session. I appreciate your help.
Wonderful. Thank you so much, Tina, also for facilitating this session. And yeah, thank you again to all of our speakers. This is such important information, and I really appreciate you sharing your excellent work and experience and perspectives just to help us better understand how to serve these communities. So thank you. Yes, we're going to take a short break. We'll be back here at 9:50 to start our second session of the day. So see you in a few minutes. Thanks, everybody.